And I'm going to make you the presenter. And now I am going to, so you can go ahead and load the PowerPoint, which you have, and I'm going to start the broadcast right now.
The broadcast is now starting. All attendees are in listen-only mode.
Good morning, good afternoon, or good evening, depending on where you are. This is Bill Maddox from the Sustainable Microenterprise and Development Program at the Carsey Institute in Durham, New Hampshire. You might see my name on the screen as Amy Sterndale, and that's just a little bit of a problem we have with our software, that Amy is the designated presenter, but I'm the person who actually does the presenting. So without further ado, I'm really happy to welcome everybody here today. We have over 100 people signed up today. We have about 25 of you who have joined so far. And let me just give you some of the rules of the road of the webinar. First of all, in a minute, I'll introduce Jan Maes, who is our presenter for today. What I'd like to do is just invite people as we go along. We will be taking questions. You'll see on your GoToWebinar box a little place where you can enter questions. So this is going to be a text-only program, which means that you will be able to type in your questions. I will moderate the questions and ask them to Jan later on in the broadcast. And there'll be, your microphones are muted so you don't have the opportunity to speak, particularly because we have a large number of participants. But should give plenty of an opportunity for people to ask questions. And if you do have any audio problems or video problems or things like that, please use the question box, or there's also a chat box, and you can send me a chat privately, or you can send it so everybody can see it, and that way I'll be able to troubleshoot problems. We have had some technical difficulties in the past, and that has meant that people sometimes couldn't hear us, and we could make some adjustments where possible. So without further ado, I'd like to introduce Jan. Jan is a friend of the SMDP. She's been a member of our faculty, both in this program and back when it was the Microenterprise Development Institute. Jan is also a fellow New Hampshireite, lives a couple hours away in the other part of New Hampshire, and also works in Africa and other places as an independent consultant. He's now the facilitator of StepUp, which is strengthening the economic potential of the ultra-poor. It's an initiative. This is SEEP's newest learning community, focusing on innovative approaches to help very poor people escape extreme poverty through a variety of economic strengthening strategies. Jan holds an MS in agricultural economics from Catholic University of Leuven, is that correct? Leuven, Belgium, and a dual MA in international management and finance from the University of Denver. I can say Denver. He specializes in evaluation and learning related to sustainable livelihoods and market development for households living in extreme poverty, and advises on programs related to livelihood promotion, microenterprise development, bottom of the pyramid marketing, and savings mobilization, especially targeting ultra-poor populations. And I'll also mention that Jan is a member of the SMDP Certificate 2012 New Hampshire program, which will be happening in just about a month here in Durham. So if you enjoy this presentation and you'd like to delve into the work that Jan is doing in more detail, then you'll have an opportunity to register for our program. We're still taking registrations for another couple of weeks. So Jan, what I'd like to do is turn it over to you. Jan is going to use a PowerPoint presentation, which you should just be able to see the screen, see the slides on your screen, and he will control the flow of the slides, and will make the presentation. When you're done, Jan, I will then start fielding some questions to you, and hopefully this will go on until at least to the top of the hour. So welcome, Jan, and please go for it.
thank you, Bill. Before I start, let's make sure that we got everyone being able to hear me. Is there a way to check that?
The voice is not clear in Sudan. Can someone else type into the question box whether or not you're hearing Jan or me? Well, I hear Sabina Rogers is there. Jesse Smith says, I can hear you. Eugenie Constancia says yes. You sound perfect in DC. Okay, so please go ahead. We're getting a lot of people saying they can hear us from different parts of the world, so please continue, Jan.
Excellent. Well, thank you again, Bill, for this introduction and for the opportunity to present on successful strategies for reaching the ultra-poor. Good morning to people who are here in the United States and in the Americas. And good afternoon and good evening to everyone else. It's very exciting to be able to have a seminar like this with people involved and attending from so many different countries. And it's also very exciting to me to see how much interest there is these days in economic strengthening and empowerment of the ultra-poor, both from practitioners, donors, and the research communities, and that is just excellent. And so what I will be talking about today is give everyone an overview of what is taking place these days, what are some lessons learned, what remains to be done, and then hopefully we can engage in a really interesting discussion afterwards. So I will talk for about the next 25 minutes and then we'll open it up to questions and we'll see what the discussion brings. And again, as Bill already said, if you have any questions, you can just start putting them in the box and send them along. So let's get started. First, I want to quickly talk a little bit about the past and the roadblocks that we've all been facing in reaching the ultra-poor. Clearly, cost and reachability have always been issues and continue to be issues, but we've made some progress in that regard. But also, and this is especially within microfinance, people have for a long time said that they were reaching the very poor and those living below $1 a day, but they didn't really know. A few years back, 5 years by now, we came up with some very easy to apply and accurate poverty tools. And when microfinance institutions started using them, even those that have the most poor-friendly programs, we're finding out that reaching the very poor really was more the exception than the rule. So that was a very important realization for those of us who didn't already know this. Another roadblock that I think was also very strong in the past was this myth of everyone being able to start a microenterprise. Give someone the capital that they don't have, preferably in the form of a loan, and off they go. Now we know, thanks to many research studies, including Portfolios of the Poor, that things aren't that simple, that the very poor and the poor have as complicated financial lives as we do, and that there is much more to it than just starting a business with some working capital from a loan. The other thing, and very much related to that, is that we've had a poor understanding of poverty and vulnerability. And I'm going to talk a little bit more in the next couple of slides about what exactly we mean when we say very poor or ultra poor and how that differs from not so poor. And then the last one, another very strong roadblock to making progress is what I've called the stovepipe syndrome. And that continues until now, although progress is being made. And one thing that, and I'll talk about this later, we will try to do within StepUp, this new initiative by the SEEP network, is to overcome these different stovepipe disciplines that even within the enterprise development field, microfinance and enterprise development people speak quite different languages and have different ways of looking at poverty. And I'm not even talking about the social sciences, social safety nets. So we all, even within some of these big multi-sector organizations like CARE and PLAN and others, even within those organizations, these stovepipes are still very strong, funded by different donors and implementing different programs, often not really knowing what each other is doing. And we need to overcome that if we really want to reach the ultra-poor and make a difference. So while I've been going through this list, I'm also asking you, what are your roadblocks? My assumption is that most of you come from a different perspective, are interested in reaching the ultra-poor, whether you're a practitioner or a donor or a policymaker or a researcher, and that you are also looking at how to improve, how to find opportunities. And I'm also assuming that many of you are probably part of one of these stovepipes. Maybe you're a member of a microfinance institution, or you're in a local community-based organization, or you are in value chain development, or you're representing social safety nets. So what I want you to do is to look at your own roadblocks, and then we can use this again when we start discussing after this presentation. So economic strengthening is a term that has been used a lot recently, and I understand that as activities, programs, and policies aimed at building the economic capacity of individuals and households. And that includes a lot of so-called disciplines like financial services, market development, including value chain development, but also social assistance, local capacity building, and working on the enabling environments. Ultra-poor, or living in extreme poverty, is something I want to spend a little bit more time on. Living below the extreme poverty line means, in general, in words that we all understand, living below the survival threshold. In other words, people who are ultra-poor do not generate enough income, including food, to survive on a daily basis. So many of these people are food insecure, are in need, live from day to day, and have a very hard time to lead productive lives. They're also, of course, highly vulnerable, and even if they make some progress, even a little shock can set them back from where they were. Or vice versa, people who are not ultra-poor can end up there very easily after a health shock or a climate-related incident, conflict, etc. So being stuck in a poverty trap is having an asset base with very low returns. And when I talk about asset base, I talk about assets not just in terms of physical assets, but also in terms of social assets, human assets, etc. And we'll talk about this a little bit more. But I make the comparison that being ultra-poor is like a company that is bankrupt. At that point, the only thing you have are expenses, daily food expenses, taking care of a sick child, etc. But you don't even have enough money or means to meet those. So it's a very difficult place to be if you want to start thinking about economic strengthening. So someone, and I think it was Jason Wolf, who works with USAID's PEPFAR program, brought in this very broad distinction among different categories of poor people. And they're very important because it tells you a little bit about what they're capable of, what their needs and what their opportunities are at a certain stage. And I think that really understanding the degree and the type, the nature of poverty is paramount to implementing programs, providing services, or marketing any products to them. And we need to go beyond people living below or above the poverty line, although poverty tool measurements have a lot of functions, including reporting on who you're reaching. But when we are designing products and programs or interventions in general, we really need to understand more about the actual socioeconomic profiles of very poor people. The three different categories that Jason mentioned are at the very bottom, those who are destitute. Then there are those people who are struggling to make ends meet. Sometimes they get by, sometimes after the harvest things are fine, but then when the harvest comes closer again, people become food insecure, they don't have any labor opportunities, and then things become very difficult. So they're still very vulnerable, but still they might be able to start being more productive. And then you have those who are still poor, but who are ready to grow, whose vulnerability has been reduced, and who can take a little bit more risk by taking a loan or using an asset to work or produce an income. Here's a little bit more detail, and again this comes from Jason Wolf. The destitute, take a look at the left side in terms of their income, which is virtually non-existent. Those are the people who beg, who get handouts, who live with another family, etc. And their expenses are also virtually non-existent because they have no money to expend them. And at this stage, even though this is a generalization, an approach that would be most effective would be provision, helping people to meet their most basic expenses for food, for health care, and other schooling of their children, just so they can have a little bit of a breathing room and start going to the next phase. There are lots of ways of doing this, but most recently a lot of organizations and programs are using cash transfers, especially conditional cash transfers, as I'm sure a lot of you are familiar with, and more often also asset transfers, and these assets are typically productive assets. People who are struggling to make ends meet on this slide, their income is still erratic, unpredictable. This is what the portfolios of the poor have been talking a lot about. They might have more than $1 a day or live around $1 a day, but that $1 a day could be $0 on one day and could be $3 on another day. So it's very erratic, and so are their expenses. So here, again, a very generalized approach could be of protection. This is about savings, getting access to credit, storage, financial literacy, learning how to manage the few assets that you have, learning how to smooth your cash flow. And then there are those who are ready to grow. And this is probably the stage where we want the ultra poor to be after a successful intervention or after providing them with services that are meeting their needs. These are the people that are typically reached by microfinance and are typically also being reached by a lot of value chain development work. Their income is still erratic, but it's higher, and their expenses become lower, but they're consistent. They're starting to meet on a regular basis their most basic expenditures. So these people are typically not food secure anymore. They can take a little bit more risk, and they're ready to grow. At this stage, we talk about promotion as an important strategy. Increase productivity for their existing income-generating activities, look at investing in new, complementary, and still low-risk income-generating activities. Economic strengthening for the ultra-poor in this diagram shows again a lot of these disciplines that are needed and that I will argue need to be there at the right time in the right amounts. Microfinance, market development, social assistance, enabling environment, and capacity building. And why so many programs, including microfinance and value chain development, have failed to reach the ultra-poor is because it was only a value chain development approach, or it was only a microfinance institution that provided services, and none of the other elements were in place. Now, how do we go in with our own backgrounds and our own core competencies and make sure that the ultra-poor are reaching more than just that one service or program that we typically see? One way, and here's a table of some very innovative economic strengthening for the ultra-poor strategies, where a given discipline is trying to include the ultra-poor through certain innovations. For instance, social safety nets, what they do, their value proposition is providing a lifeline, allowing people to move above the survival threshold. So these are the destitute people that through a social safety net, whether it be a cash transfer or other safety nets, can at a certain point have more consistent meeting of their daily expenses. They are going to a place of increased food security and also being able to better manage health issues within their households. Weakness of a social safety net is that those are not designed to provide economic opportunities. It keeps households from falling down, but it does little to help them move up. But they are extremely important. An innovation that I know has certainly been very successful in Peru is where a conditional cash transfer was linked to savings. So people who were already recipients of these conditional cash transfers were asked to open a savings account and to receive their cash transfers on that account so they could still enjoy the social safety net and at the same time started saving. So here's already some crossover from social safety net to a microfinance strategy.
Hey, Jan,
microfinance, sure.
I just wanted to ask if you could just give a little explanation of what conditional cash transfers are, just in case that's a new term for people.
Sure, and I'm sorry about that. So conditional cash transfer programs are programs that have, especially in Latin America, been implemented at a very large scale. And the idea is to reach the poorest households in those countries and to provide them with a safety net so they can meet their basic expenses. But those, and that's where the word condition comes into place, the condition here is that it varies by country and program, but often the conditions relate to what these households do with their children. And conditions include having them go to school on a regular basis, and where they often get a nutritious meal at lunchtime, or attend regular health checks, etc. So that's where the condition comes in. And these programs have reached millions, and if not tens of millions of people in Brazil with the Bolsa program, or in Mexico, where I think the program is called Oportunidades. And there are many more. And they also are slowly becoming more used in African countries. The issue, of course, with conditional cash transfer programs is that the governments who implement them have to have the revenues to be able to fund them. Microfinance is a discipline that I'm sure many of you are very familiar with, providing access to financial services. We used to talk about microfinance as what I call the micro enterprise myth, as something that helps people to start businesses and expand businesses. In many cases it does, but in more cases I think microfinance is important for income, expenditure smoothing, and other financial needs that people might have, not necessarily productive needs. Some of the weaknesses, although progress is being made on an almost daily basis here, is that products are not always matching customer needs. The typical microcredit loan and the loan terms are often not matching when people have cash and when they can expend cash. But again, there are many innovations. Products are much more market-led and customer-led than they were before. Other innovations include savings groups that have, especially in Africa, blossomed over the last couple of years. We all know Microcredit Plus programs, where microfinance institutions provide, in addition to the financial service, also health education or agricultural extension or financial literacy programs. Microinsurance is making large strides forward and is reaching deeper and deeper in terms of the poverty level, but at the level of the ultra poor, the challenge is still great. And then, of course, social performance has been a very important topic in microfinance as a way of making microfinance much more demand-led and customer-led and making a social difference in addition to just a financial one. And lastly, within market development, the value proposition there is working at the market system level and making markets work for those ready to grow. The last category I talked about, these programs still miss a lot of the poor people in these areas, and certainly the destitute. However, even though they don't always measure this, some of these people are getting employment, whether it be formal or informal, on farmers' lands who are less poor, etc. But again, the very destitute and struggling households often do not directly participate or benefit from these programs, but as I said, sometimes they do indirectly. Innovations here too are, and I will talk about this in my next slides, there's linking to push strategies where market development looks at other service providers, including social ones, who help very poor people to be able to participate in value chains of markets. And they're also much more aware that in terms of reaching the poor, the focus has to be on low-risk economic activities with low barriers to entry. Push strategies, as I just mentioned, are examples of them are social capital, when people, for instance, join a savings group, and in addition to being able to save and borrow from the group capital, they also have support mechanism, they develop social capital, they develop bargaining power, etc. Confidence building is a human asset, but it's extremely important with the ultra poor, who often have very low confidence. Savings rather than credit is more important at this stage because people have so few assets and cannot risk taking loans. Conditional cash transfers, asset transfers, all of these food stipends are considered push strategies, but they don't have to be only at the provision level. It could also be at the protection level and at the promotion level. So even when the intention is to develop economic capacity and microenterprise, certain strategies can be pushing people to help them participate into these programs. Push strategies are also not the same as subsidies. Cash transfers clearly are subsidized, as are food stipends, but implementing savings groups and other such things are not. The other issue, and especially when they are subsidized, is that push strategies, since they are aiming at building capacity of households and communities, need to be accompanied by effective targeting. And lastly, an exclusive focus on push strategies is not sustainable and creates dependence. And this again is the stovepipe syndrome, where lots of social programs have existed in the past, but they keep continuing because there's no exit strategy. People are doing fine, their incomes are more stable, but they have no next step. Pull strategies are when certain systems and institutions are in place that are open to be accessed and to provide opportunities. Here the emphasis is not on the households themselves or on the micro-entrepreneurs or borrowers. Here the emphasis is on systems and institutions. And what these can do in pool strategies is to make their approaches more poor-friendly. For example, an MFI can customize products so that they are more appropriate for the very poor. They can add non-financial products. They can provide links to informal or more formal savings groups. A value chain program can engage very poor producers if they are inviting them to multi-stakeholder platforms, etc. So a lot of these pool strategies can become much more poor-friendly if they think about these things and if they want to do this. Ultra-poor can engage not only as producers, again the microenterprise, that potential is sometimes limited, but they can also enter into value chains or markets as consumers and workers. As consumers, they can, for instance, have access to products that reduce their expenses. An example of that is a fuel-efficient cook stove. If someone can access a fuel-efficient cook stove that uses half of the amount of firewood than they use by a traditional cooking method on a 3 stones fire, for instance, it will reduce their expenses and help them that way. And of course, there are many other examples as well. And a lot of potential needs to be further explored, I think, in how to engage the ultra-poor as workers, as employees, informal as well as formal. Again, pull strategies, just like push strategies, can be at provision, protection, and promotion level. An example of where a pull strategy is at provision level is a government safety net program. These are being made available, and sometimes the challenge is for the very poor to access them, even though they're intended for them. Key features of pool strategies is that instead of direct provision, the emphasis is on facilitation. A value chain development program is not going to provide direct income opportunities or establish enterprises within the value chain. It's looking at challenges and roadblocks and trying to remove those and indirectly open up the value chain and provide opportunities for value chain players from the very bottom to the end of the value chain. But an exclusive focus, as my last point, on pool strategies will not reach the ultra-poor. Maybe to some extent indirectly, but usually very little. So one of the strategies and one of the challenges we face is to connect push and pull. The first bullet point, I call it balancing the active demand and supply of economic opportunity. Opening up markets, making markets work for the poor will provide new economic opportunities, supply them. And so there also needs to be the demand. if a push strategy is preparing a lot of people to exit social safety net programs and to wean them off from cash transfers, for instance, but there is no new economic opportunity provided by a pull mechanism, then there'll be a problem. So at the very least, if we want to reach scale, those two have to be coordinated. Push strategies need to be sustainable as well, and that's a challenge. Cash transfers and asset transfers cost a lot of money. If we can do this once and see success, that'd be fine, but what we really want to see is a mechanism where we can walk away and we don't have to generate the funds to continue to provide assets or cash transfers. And we are beyond one-time interventions. As I said before, coordination is absolutely essential, and more stepping up for people to graduate, as a term that is being used a lot, from very poor to less poor, is much more difficult to achieve than falling down. Again, a small shock can bring people back to where they were. And that brings me to the next point, which I think is a very important one. We've talked a lot about pathways out of poverty, and while they are a good way of looking at the interventions and programs that are needed for a household to go from a place of being very poor to one where they become less vulnerable, in the end what we want to see is a segmentation. We want to see an environment where these programs and services are available when they are needed. And when people reach one stage through a certain program, whether it be, for instance, access to savings in a village savings and loan group, that they also have access to mechanisms that if a shock occurs, they don't fall right back to where they were before. And here's another very important point, and I'm stealing this from market facilitation strategies. We need to look at this at a very systemic level. No single player among us can do this alone. And we also don't want to go back to the top-down integrated rural development model that was so popular in the 60s. We don't want to have it centralized, but we want services and products and interventions to be available when they're needed. So lots of players are needed, and we need to have places or occasions where we can make joint assessments of what the issues are that are preventing the ultra-poor from entering markets, that are preventing the ultra-poor from having access to food, to savings, etc. And these have to be multidisciplinary assessments, and then they have to be multidisciplinary joint approaches. But again, I don't think that heavy-handed partnerships are the answer, but that coordination and connecting the dots is where we need to go. And that involves non-governmental organizations, governments, as well as the private sector. Here's another brief description of push and pull and how it relates to providing, protecting, promoting. In the interest of time, I'll just let you take a quick look at it, but I want to move forward so we have enough time to have our discussion afterwards. But again, this protecting, it's not only about providing and bringing people to a certain level where they are able to become productive, and it's not only about promoting where markets are being widened and opened up, where value chain development is done. There's also this very important place for protection, and this is done by financial services, including microinsurance, but also savings and credit and remittances, by safety nets, that can be government provided, but sometimes are also community provided, and by education, health, business skills, financial literacy, as well as confidence building. One quick example that will illustrate very well is a case study I just wrote about AMPAT, which is a health provider in Kenya. They were present in response to the emerging HIV crisis and started focusing on helping, providing health care to people who were affected by HIV/AIDS. 5-10 years later, they were helping hundreds of thousands of patients, but they also started to see a need for food support, because in order to become better, people didn't only need access to health and medicine, but also to not only sufficient, but also high qualitative, nutritious food. So they started providing that. And some people, the most vulnerable ones, started to receive food support. Now that became a problem because these people became very dependent on the services that were provided by AMPAT. So they were looking at economic opportunities. At the same time, in Western Kenya, where they are present, some organizations, including the Export Promotion Council, was doing a lot of value chain work around passion fruit. And the idea was to link these ultra-poor, who were already receiving these push type of services like healthcare, food support, as well as psychosocial counseling and many other things, to economic opportunities that would be provided by a very typical pull strategy, developing a promising value chain for which there was a very big market, passion fruit in East Africa. Now what they found was, but this was only after 1 year, that most vulnerable people were not able to move into the passion fruit value chain. And the reason was very simple: they didn't have the assets. Even though you don't need a lot of land, half an acre would be enough to grow passion fruit and make a fairly good income. These very vulnerable people didn't even have that amount of land. So what they were able to do is they were able to join savings groups and start saving and start building up working capital from which they could borrow. And they also started growing African leafy vegetables and other vegetables, which were helping them in terms of their own food security. And we're also providing for many of them a marketable surplus. So that was a significant change from being destitute to struggling to make ends meet. But the program is still looking at this next step. How can these people who have no land get at the stage where they have more profitable enterprises? The following slide is one from CARE in Ethiopia, where they are one of the partners involved with the Productive Safety Net Plus program. I don't want to go into the details, but I think it's a very nice slide for all of you to look at and see where push strategies and pull strategies come in. And while they call them, instead of destitute, struggling to make ends meet and ready to grow, they call them chronically food insecure, vulnerable to food insecurity, and food secure, which is very similar. And you can see at the sequenced approach that is being used by quite a few organizations, including the graduation program that's being promoted and tested in 10 different countries by CGAP and Ford Foundation. StepUp is an initiative by the SEEP network that I am very related with. I am one of the 2 facilitators together with Margaret Richards, and it was born out of the Poverty Outreach Working Group. Our focus here is, of course, on the ultra-poor, that might be obvious, but the reason I'm putting it as a separate bullet point is that unlike a lot of other working groups and initiatives, we're not focused on a certain type of intervention, on a certain type of institution, or a certain type of product. Our focus are the ultra-poor households themselves, and what needs to be done in order for them to move upwards in an economic sense, to move towards economic self-reliance. So that brings us to the next point. We want to connect these different silos of practice because once they all come together, and by the way, each context will be different. A program that might work in India might not work in Mali. But in general, we're looking at integrated systemic approaches and doing this from the very beginning, at the assessment, design, during the implementation, and also during evaluation and learning afterwards. There is a big role to play for facilitation and coordination among players and actors that might not have prior experience in working with each other. And we're also thinking about advocacy towards government, towards private sectors, and linking to other initiatives. And I want you to invite this discussion. If you want to sign up for this group, there's a StepUp discussion group on LinkedIn. Here is the address. If you are interested in signing up, just visit it, introduce yourself, explain a little bit about your challenges, and let us know how the StepUp learning agenda, which is still emerging, can help your specific issues. We'd love to hear from you. We'd love to hear from, especially countries in the South, what the issues are they are working on, what the obstacles is that you all have identified. We also think that we can continue this discussion that will start in just a moment on the StepUp LinkedIn group. So if you have any questions that might not be answered today, no worry, come to StepUp and we'll talk more there. If you want to learn more and get involved besides the StepUp discussion group, Bill already mentioned the SMDP New Hampshire Certificate Program, which will be June 18 to 29 this year in New Hampshire. And here are two important websites and initiatives that I think are providing a wealth of resources. You have the CGAP Ford Foundation Graduation Program, as well as USAID's Microlinks website, which has a fantastic value chain development wiki with entire chapters and resources on how to include the very poor. So that's it. I am interested in hearing your questions and look forward to an interesting discussion. Thank you.
Great, Jan. Excellent job. We do have a few questions, and I'm going to start with Sabina Rogers, who has asked that, she says, I know ONPATH was a partner in SEEP's Value Initiative. Do you know if there are any results and assessments from their action research in that program?
Well, I'm the right person to ask, as I've been involved with writing up case studies, and they are, as we speak, being finalized by the SEEP network, and will definitely be made available. So keep your eyes open for them. I'm sure SEEP will disseminate them and reach lots of people, but if you don't, come visit us at StepUp, because we are also looking at ways to discuss these accomplishments. And by the way, it was not just AMPAT in Kenya. There was a program in India as well as Indonesia and Jamaica. And the focus was on urban value chains, but one of the sub-teams was on how to include the very poor.
Great. So Gail Motzi has asked the question, are the poverty measurement tools that were referred to available through the SEEP network? Are they the SLF and HEA mentioned in one of the slides?
No, they are different ones. So the ones that I mentioned in the slide, and I'm sorry that I didn't, that I skipped that. The Sustainable Livelihood Framework, SLF, provides a lot of tools to look at livelihood assets and looking at not just the physical and financial ones, but also social, human, and natural, and even political ones. They don't have any specific tools to determine household economic portfolios, which is the other tool that I mentioned, HEA. But they do certainly provide a lot of insights and examples on how a program could do this. By the way, I think one of the jobs for us as practitioners, whether it be in StepUp or somewhere else, is to develop or to come together and learn from each other what tools people have used, not so much to measure poverty for the sake of measuring, but for learning how that relates to program design and program monitoring. There are lots of places where these tools are being developed, but it's still sporadic, and we don't know about each other's work in that regard. Household Economic Analysis, HEA, is a little bit, it's actually a great tool. The only problem with that one is that it's quite expensive to implement, and for that reason not being used as much. The poverty tools are the poverty assessment tool that was developed for USAID, which has to report to Congress on its outreach with microenterprise development, to what extent they're reaching the very poor, those living below $1.25 a day. And there are also the Progress Out of Poverty Index tools that were developed by the Grameen Foundation. Both those tools are available, they're all at a national level, and they are available very easily. If you can't find them, just shoot me an email and I can steer you to the right place. But both the PATs, Poverty Assessment Tools, and PPIs, the Progress Out of Poverty Index, are available to the public.
Gail actually had a follow-up question. I don't know if it was a follow-up, but another question, which was, do you see a link or similarity between your approach and a sustainable livelihoods approach?
Absolutely. I think there is lots to be learned from the sustainable livelihood approach, because it, again, emphasizes that economic development, especially for the ultra-poor, who have such low levels of human assets and social capital, that economic and social development and human development are so interrelated. So the sustainable livelihoods approach has always mentioned that, and I think it is also a very useful framework to be used in working with the ultra-poor.
I have a long question here, so bear with me, Jan. This is from Sanchari Datta, and there's actually a couple of questions embedded here. Ultra-poor are like extreme cases and need special attention in terms of selection and implementation. To reach them, selection is important, as mostly it is seen organizations take up the poor on the third stair of ultra-poor ladder, and as all programs are output-oriented. My question is related to scaling up. When we are trying to reach thousands, tens of thousands of poor at a time, making it a national level policy to reach the ultra-poor, how can the selection be done? Is there a chance of dilution again? Even in terms of program implementation, what can be the best possible strategy? A microscopic view of reaching the ultra-poor cannot be taken in most cases as it becomes a community approach. Practically, it shows then in such a situation, little better off or higher in the latter try to take advantage. Ultra poors are losing out. So what can be the right possible strategy of mass scale programming for ultra poor, along with special individual focus towards pulling them up on the ladder, horizontal versus vertical approaches? I think this is a very critical question because the pilots that are currently underway with the Ford CGAP program are really, in essence, reaching a tiny fraction of the potential market out there. So what are your thoughts about this, Jan?
Well, thank you, Sanchari, and hi for that question. Sanchari has been very much involved with the CGAP graduation program, especially in India, but also in some other countries, including Yemen. So she knows where this question is coming from, and I think she can also answer it as good as I could. But I'll give it a try because these are indeed some very important concerns and challenges that we're still facing. What a lot of people are saying is that if these social safety nets are not provided, it will be very difficult. Countries like India that have these, that also have guaranteed employment programs, start from a different level because that's already present. But as I mentioned, it doesn't mean that that's enough. Even though some of these programs might be intended and targeted at the very poor, Sanchara is absolutely correct that they don't always reach them and that there is a lot more needed than just having a government program. And this is where the analogy of push and pull comes into place too, because I would consider this government program as a pull strategy. It's ready there to be entered, but it's certainly not coming to your doorstep. And what some of these graduation programs, Trickle Up in India and Bandhan in Calcutta in West Bengal, have helped, among other things, people to increase their social capital and go after these programs that they have the right to, which makes a huge difference. I don't think I'm answering all the questions Sanchar is asking, but another one is that, and these graduation program experiences have shown this over and over again, that there is a very important role for what sometimes a little is called hand-holding or coaching, maybe better, where households, as you can imagine, are at such dire levels where they need visits once a week by a caseworker or social worker who helps them find, even identify that they have a health issue in the family, help them learn where to go if a health clinic is present, help them to take good care of the asset if there's an asset transfer, like, for instance, goats, so they can start growing assets and some income later on. Help them gain that confidence. And that role is crucial and requires fairly well-educated field workers, of which there is a short supply. So in the future, if we want to scale this up, I think some of the solutions will be that there is a lot of local capacity development where NGOs and community-based organizations will be in tandem with the government, help those people reach the services that are intended to them and leverage them so that it isn't just a social transfer, a social safety net, but there are also opportunities created in markets and economic development in general. I hope that answers your question to some extent, Sanchari.
So that's why it's really important to have, first of all, to work on breaking down the stovepiping syndrome and really getting in large institutions like governments involved, because this is such a huge task that really can't be handled even by very large NGOs. The next question I have is, from Eugenie Constancius, who is, I'm working at EDM, Entrepreneurs du Monde, a French NGO working with a network of 12 partner MFIs worldwide. My question is, do you think that microfinance services have a role to play to the destitute people or only to individuals under the struggling to make ends meet category?
Excellent question. Thank you for that. I think microfinance institutions do have a role to play, but they also have to understand their markets. And so where I think that in the past, microfinance institutions were providing too much credit at all levels. They're now understanding, and I think that's the big challenge in addition to social performance for the microfinance sector, is to also provide sustainable savings services at massive scale. And savings can be used by just about anyone, no matter how little money you make. There's always room for savings. But again, those savings have to be adapted to the needs of the client group. And in the case of the ultra-poor, that means that savings has to be very flexible and very easily accessible so they can use them when they need them. But so another part to this question is that the Microcredit Summit still has its goal of moving 100 million people above the $25 poverty line. And I think that as a microcredit or as a microfinance movement alone, this will not be possible. So they are important and increasingly so, but again, if they cooperate, if they leverage the efforts of other programs or interventions, including social ones, or agricultural extension, which BRAC has been doing in several places, etc. By the way, the one part I forgot to mention to Sanchari's question is one other way to put the challenge ahead of us is how can we replicate what BRAC does in Bangladesh without hoping for another BRAC? Because BRAC really brings all the pieces in place, but there's very little chance that another country will have another BRAC. But how can we bring some of those pieces of the puzzle together while they come from different organizations and stakeholders?
We're now 3 minutes after the hour, but I think we have a couple of more questions, and if you're still with us, there's apparently 40 people who are still tuned in, so we're going to just keep going for a couple more minutes here, and I do have some important announcements, so please stand by and we will keep going here. Some of the successful, I'm sorry, this is a question from Tatiana Rincon. Some of the successful strategies for reaching the ultra-poor are very detailed and require multiple and precise interventions, such as the TUP/BRAC model. How to design lean programs that are less expensive, easier to implement, and that could reach more people? That's a hard one.
Yeah, yes. Thank you for that one. And I think I alluded to it in my last comment, that targeting the ultra-poor program at BRAC is indeed a very intensive program. But I think we need to be honest in one way, and that is that the ultra-poor will need to some extent assistance through subsidies. There's just no way around it. This is how the very poor move up in industrialized countries, and this will be even more so in less developed countries. But there are always ways to do this more lean, but Tatiana is right that some of these interventions are very precise and customized. So one answer to that, again, is to take a systemic look. I don't necessarily think that a graduation program, for instance, can be replicated as is in any given context, but a lot of it can a lot can be learned from it. But it is a matter of bringing the right pieces together. And also, I think it's a matter of realizing that when these pieces are not together, it might be better not to do anything or be less ambitious about who you want to reach. If there is very little social safety net available, the opportunities are just much less than they are in a country where a government-funded social safety net exists. So to some extent, I think we will stay more intensive, and we need to get away from the financial sustainability goal that we have around microfinance. But what remains important is that a subsidized approach relates or evolves into a sustainable impact. So I think a subsidy is perfectly acceptable if the impact that you generate can be sustained afterwards. If you find out that after 2 years the program is not being funded and all the advantages disappear, then I think that's the wrong way. But if subsidies can provide a sustainable impact where there's no other approach, then there is and of course there are lots of issues around grants and how to distribute grants, how to target them, but I think that's a different issue.
I think institutions have to take a long view of doing this work and not think that you're going to try out a program for a year or two and then withdraw the subsidies and then not see things go back to where they were. It's a challenge. It takes a lot of resources. We're down to we're 6 minutes into overtime here, but I think I want to ask one more question. This is from Susan Wesley Vega. Typically, MFIs work with folks higher up on the economic ladder. NGOs typically work with folks who MFIs do not work with for all the profile reasons you described. Can you suggest specific push-pull collaborative interventions between MFIs and non-MFIs, NGO types, projects to help push the poorest folks up the ladder to attain a more empowered position up the ladder?
Yes, I think again that depends on the context, but there is a big role to play. Maybe one example, even though I can't claim I'm very familiar with it, is what CARE is doing with Access Africa. As many of you know, they have been expanding their village savings and loan program in many countries in Africa. But they're also, and as you rightly say, reaching poorer people than microfinance institutions would in the same context. But at the same time, and that's where the pool comes in, CARE has been very actively looking at links of bringing these village savings and loans groups into the formal financial system, so they can borrow money or leverage their funds with MFIs or banks into the new technological solutions that exist in conducting microfinance, as well as in value chain development and market development projects. And VSLAs, I didn't emphasize this, but in many places, and of course not just VSLAs, but savings groups, as well as the Indian model of self-help groups, which are very similar in many ways, have a very important role to play between, to connect, push, and pull. They're sustainable. They will be there for a long time. They're community-led. They provide more than just finance. Social capital is often even more important than the financial benefits. And they are from a transaction point of view, from a delivery point of view, it is often much easier to reach 20 people in one go than to reach individual households, whether it be a fuel-efficient cook stove distribution or marketing chain, or whether it be access to formal microfinance, or whether it be agricultural extension in rural areas. So savings groups, I think, have a very important role to play. But at the same time, I also think that savings groups sometimes aren't always aware of the issues that the ultra-poor have and might unwillingly be excluding the ultra-poor as well.
So I was going to make that the last question, but actually Nahid Mirghani of Sudan has asked a question related to VSLAs, and I think it's important to make it the last question. In Plan Sudan, we implement the village savings and lending approach. Group members asked to link them to banks to have a fund to invest to increase their income as the credit from the groups is low. So bank credit can enable them to invest, but there are challenges with this bank linkage. I know Hugh Allen, who teaches with our program, is very much a skeptic of bank linkages with VSLAs and generally says that they don't need them. But in this case, Nahid is saying that actually supplementing bank credit could be helpful to the group. So what is your opinion on this, Jan?
Well, I know that Hugh Allen is very much opposed to them, but then CARE in its current program is pursuing them. It's a fine line, I think, and I think Hugh Allen would agree with that too, that you really have to make sure that this is demand-led and not supply-led. So if you want a bank and you're looking at the microfinance institution as a way to expand their market, what you have to do first is see whether there's a need within these village savings and loan groups, whether they are interested themselves and whether they understand what the implications are. Because one thing that Hugh Allen always points out is that access to external credit also changes the dynamics within the group. All of a sudden they are managing funds that don't belong to the group, which can bring in a lot of implications and can also cause differences between those who can use credit and those who are in these groups but are more in there for savings, not so much for accessing credit. So I think it needs to be looked at. In Sudan, where I was recently, the microfinance sector is only starting to develop, and there are lots of issues, but it's a very exciting time there because I think there will be more opportunities for microfinance. Bill, were there any other questions? Hello? Well, I will, in the case that people are still hearing me and we lost Bill.
Nope, I'm here. I'm back. Sorry.
I want to thank everyone for...
Jan,
oh, okay.
Can you hear me?
Yes, Bill, I was just fearing that you would have left, and I started to close, but it's back up to you.
Okay, sorry about that. I thought I had unmuted, but I muted and unmuted. We did have some additional questions, but I'm going to send them to you via email, and then you can reply. We'll reply back to everybody in the conference who was here with those responses, because it is getting kind of late here. I did want to make a couple of quick announcements. This webinar series does continue after today. We continue through the rest of the year. Our next one is going to be on Wednesday, July 11th, with pro-poor enterprise and value chain development, advanced topics. Specifically, we're going to be talking about principles for successfully engaging with lead firms in value chain development. This is with Katie Turner with Mennonite Economic Development Associates. We will put a detailed description up on the SNDP webinar site, probably within 2 or 3 days. But essentially, this is going to be this is for people who are already doing value chain development and interested in learning more about lead firms and working with them. We will be continuing on that topic actually in October when we have the SMDP Tanzania, which will be taking place in Arusha, Tanzania from October the 15th through the 26th, and that website will be up any day now, probably in the next 2 or 3 days. It was supposed to be up today, but we should be able to get it up very soon. And we will be having, as Jan graciously plugged, we're going to be having the SMDP New Hampshire certificate next month here in Durham from the 19th to the 30th, and be an opportunity to get exposed to many of the leaders in microfinance and enterprise development movement, including Jan, and meet with practitioners from all over the world. So there's still room to sign up for that. I appreciate everyone's great questions. I appreciate the really excellent presentation that Jan gave, and as I did point out to you that we're following along with the chat questions, is that we will be posting this recording up on the website along with the PowerPoint, so you'll be able to access it in 3 or 4 days, by early next week at the latest. So you can really go back and listen to this or watch the screens anytime in the future, or pass it on to others. This is a very important topic. A lot of groundbreaking work is being done on this, and I want to say again that you have a great opportunity to participate in this discussion by getting on the StepUp LinkedIn page, which Jan has put on his presentation, but I will also make sure that it shows up on the website in the description of past webinars for this particular event, so that you can link to it. Again, thank you for your participation and your attention, and Jan, I appreciate your great work on putting this together, and I wish everyone a great day and good luck.